Let's start with the key findings. As I said in the introductory comments, the efforts of Ontarians are making a difference. Cases are cresting, but they're cresting at a very high level. ICU occupancy is at record highs and continues to climb, and our system is under incredible pressure, unlike it's ever faced before. Workplace mobility is still too high. Limiting essential workplaces and keeping sick workers at home will help control cases. Clearing the surgical backlog will be an enormous challenge. Vaccination distribution is more equitable because it is focusing on hotspots. Continuing this progress and increasing the vaccination rates in our hardest hit communities will be essential to progress. Ontarians can make outdoor activities safer with distancing and masking when close to those outside their household. Indoor activities, I want to remind people, pose a significant risk. So let's look as we start as we always do by looking at case rates across public health units in the province. You can see that cases are flattening, but pockets of growth do remain in hotspots. And this level of growth in some cases is still exponential, and that's the type of growth that can explode very, very quickly. You can see here that there are an increasing number of public health units, although still not the majority, that are reducing their cases. And I should point out as well that the case rate right now is still very high, what we consider well above the control or red level in the province. For those of you who've been looking at the recent or are interested in the recent reproduction numbers, the tendency or the likelihood that someone passes the case on to other people, it's about 0.9 right now. So that means that we're starting to see a deceleration. We're starting to see a cresting in the number of cases. But important to keep in mind as well that the number of cases is still very, very high. Here we're showing test positivity rates, the proportion of tests that are positive. These are still very high across Ontario. You can see that it's about 8.9% when we calculated the chart earlier in the week. It's fairly consistent at this level, and this again is a very high level of positivity. This is above what we would have considered before, above the red or control zone, so it's a very high level of positivity. So high case rates, high positivity rates. And if you look here on this slide, testing rates are flat or a little bit down. So we always look at three numbers when we look at the current state of the pandemic. We look at the number of cases, we look at the percent positivity, and we look at the testing rates. And so cases are flat, positivity is high or maybe up a little bit at times, and testing is flat or a little bit down. All this means is that the current plateau is very precarious. This is the place where you can either start to drive down the pandemic, drive down the case rates, drive down the number of hospitalizations, drive down the number of admissions to ICU, and drive down the number of deaths. Or if we see a change, as we've seen in the past, you can see a substantial exponential growth in the cases and really a continuation of the third wave or a fourth wave. Continuing on here, you can see the proportion of cases, which are variants. The orange part of the graph represents the cases that are variant-driven cases, predominantly the B117 variant, which is the variant initially identified in the United Kingdom. As you can see, and as predicted, the proportion of cases that are variants is exceedingly high. It's now more than 90% of all cases are a variant, a new variant in the province. Although most of them are B117, the prevalence of the other variants, the ones that were first identified in South Africa or Brazil, are increasing, and we have seen now in this country the variant that was first identified in India.